This is Dr. Anderson with North Texas Plastic Surgery, and today I'm going to talk to you about a very important topic, which is safety regarding your surgery, specifically related to your mommy makeover. If you come to see me in clinic and we start going down this pathway of talking about this, you are going to hear me say something to the effect of, you are asking me to do a surgery that you absolutely do not need. This is surgery you want and would like to have. From my perspective, if we're gonna do that, we are gonna do it as safely as we possibly can. What I'm gonna talk about today are things that we're going to do before surgery, during surgery, and after surgery so we can optimize how safe we can be with you. Before surgery, obviously you're gonna come in and see me, we're gonna have a consultation. Part of the consultation process is asking you about your previous medical history, because not everybody's gonna come in the same. Some people are gonna have high blood pressure, some people are gonna have diabetes, other pre-existing conditions that we need to be aware of, again, so that when we get to the operating room, we can make sure that you are optimized so we can decrease the likelihood of a bad outcome. So it's gonna be very important when you're filling out your paperwork to be as honest as possible. And I know you're gonna do that, but sometimes people come in and they're like, oh, I don't have high blood pressure because I take a medication and now it's normal. Okay. I get that. And that's kind of fun to think like, oh, I had this condition, I went to see my doctor, they helped me, they treated it, and now it's normal. But that's still stuff that we need to know. So let's say we've gone through our consultation process, we have all of that good information that you were very, very honest about. Then what we're gonna determine is what sort of clearances we need to do before surgery so we can make sure, like I said, that all of those things are optimized. Now, that may be a neurology clearance if you have a history of seizures, maybe medical clearance if there's diabetes or high blood pressure, hematology clearance if you have a family history of a bleeding or clotting disorder or a personal history of a blood clot, maybe after a C-section, something like that. So we'll determine if there's any extra specialists that you need to see, again, to optimize. Now, for most people, especially if we're talking mommy makeover surgery that takes a while to complete, at bare minimum, we're gonna need lab work to make sure that all your blood levels are where they need to be, and an EKG to make sure that your heart rhythm is normal. Common things that we may see with blood work are, well, the most common is anemia. So if your blood counts are low, there have been patients in the past that blood counts are low, they work with their primary care doctor, get on an iron regimen or whatever it may be to optimize those levels prior to your actual OR date. The other thing that may be common in my weight loss patients, specifically patients that have had surgery to help with their weight loss, is their nutrition numbers may be not ideal, specifically protein levels. So again, if those protein levels are lower than they need to be, we may need to push out surgery a while so that we can optimize diet and get them to levels where we can optimize healing. If you come into surgery and your protein levels are significantly low, the likelihood that your body is able to heal an incision without incidents decreases. And obviously, again, for this elective surgery, we would like for you to heal with as few problems as possible. Other things that may need to be in consideration are for my patients that are over 40, if we're doing a breast surgery, we need a mammogram within the last year because it'd be kind of foolish if there was something suspicious on that mammogram and we're doing some sort of elective procedure when some medical procedure may be required. That's obviously going to be the minority of patients that happens, but we're going to cross our T's and dot our I's to make sure that that's the case. After we have determined prior to surgery that all of those things are in order, and I'm getting ahead of myself. I should say that I'm going to review all of that stuff as well as our anesthesia team is going to review all that stuff. So we have multiple sets of eyes, just again to make sure that we're not missing anything and that safety is optimized. So then during surgery, of course, there's lots of things, and I probably don't need to be quite as in depth about this. Not that it doesn't matter, but it's so many things it can be hard to kind of even comprehend. So some of the high points are, prior to surgery, we're gonna put on some compression stockings. And then right when you get into the OR, we're gonna put on compression devices that go up your leg. The point of those is they're doing multiple things to help prevent a blood clot. So if you go deep into the surgery and anesthesia literature, you'll see that anytime a person has surgery, they're potentially increasing their risk of a blood clot. So we're going to do things to prevent that, and we'll talk more about what we do after surgery for that as well. We will put on all sorts of monitors to monitor your blood pressure, your breathing, your heart rate, so that we can maintain those numbers within ideal during surgery. And then some of the other specific things, we're going to maintain a temperature during surgery that decreases risk of infection as much as possible. And then from my perspective, I am going to be as efficient as possible in the OR so that we can keep our time under anesthesia to, I don't want to say to a minimum because it takes some time to make everything look as good as possible, but we're going to just maintain efficiency so that we're not messing around and keeping you asleep longer than you need. Then, as surgery is completed and we're waking up and we go to our post-anesthesia care unit, we're going to continue all those things. Maintaining oxygen levels where they need to be, maintaining your blood pressure where it needs to be, monitoring body functions like urine output where that needs to be, and we'll titrate the things that we are doing to optimize those things for you. If you're having Mommy Makeover, you're gonna stay with us overnight. You can't stay with us forever as much as some people would like because it's nice to get a little break from the house, but we obviously have to send you home. So most patients want to then know that they're doing everything they can once they get home to prevent complications and keep the risk as low as they possibly can. So some of the things that we're gonna start with, you'll continue to wear those stockings that I talked about. You're gonna get up and walk frequently. It's the pumping action in the calves that helps your body release chemicals that help prevent blood clots. In addition to that, we're going to do a shot of Lovenox, and Lovenox is a blood thinner. It's not a strong one, but it's strong enough. You're gonna do that for 8 days after surgery, again, to help prevent the formation of those clots. In addition to that, on top of all that, we're gonna get an ultrasound either the day after surgery or 2 days after surgery, and we're actually gonna look ahead of time. Because sometimes what will happen is you can form a small clot. It's frequently around the knee if it's going to happen. And if you find it before it causes symptoms, you can treat it, and then it will never cause symptoms most likely. So again, we're doing all those things to optimize safety, and that's like probably talking too much about specifically blood clots. Now, other things we're gonna do. You're going to go home with this little breathing machine. It's called an incentive spirometer. You're going to work on that every hour while you are awake. And what that's going to do is it's going to help keep your lungs inflated. Sometimes after surgery, because those muscles are really tight, the tendency is not to want to take deep breaths. And if you do that, the very, very ends of your airways, way deep in your lungs, can kind of collapse on themselves, and that can increase your risk of pneumonia. Obviously, nobody wants to get pneumonia after surgery, or quite frankly, ever. So working on that breathing machine is going to help keep those very distal airways inflated to reduce that risk. It's also going to help keep your oxygen saturation numbers super high so that we know that you're delivering oxygen to all these incisions so that they can heal optimally. We will also send you home with this little device that goes on the end of your finger. It measures the oxygen number for us. It also monitors your heart rate. A lot of times after surgery, the appetite is not quite as strong as it normally is. And sometimes if we're not drinking enough fluids, that will then manifest as a high heart rate. So that little device will, again, show us our oxygen number, and it will show us our heart rate. It can kind of help determine if there's some other things we need to do, again, to be optimizing. In addition to all this, you go home day after surgery, you'll get a nurse call the following day to answer any questions that may have arisen, and then if there's any troubleshooting we need to do so we can just, again, keep you as safe as possible. We'll continue on with all of our other follow-up regimens, and then it's also important to note that you have multiple phone numbers so that you can contact us anytime you think something is going on or you need questions answered. And in addition, we have the Clara app that is HIPAA protected, and we can be answering questions to keep you as safe as possible. That was kind of a lot of information really fast. I was probably talking too fast. So I just wanted to let you know all of the things we are doing to keep you as safe as possible so we can get through this elective surgery and get those results as quickly as we can afterwards. This has been Dr. Anderson with North Texas Plastic Surgery. If you like content like this, please comment, like, subscribe below, and we'll keep making it.